Get started here in just a few minutes. Hi there. This event here starts at 11, so we got a few minutes. We'll just kind of hold tight here. Happy Friday, everybody. I don't know about you all, but I'm ready for the weekend. It's like we got a couple minutes till 11. I'm curious, those of you that are joining, where are you joining from? Where are you located? And can everybody see and hear me okay? Thumbs up. Okay. Hi, Tammy. Ooh, the Netherlands. Awesome. How's the weather over there? Hi. Chicago. Last time I was in Chicago was for Fancy. Fancy 2017, the only one I've been to. That was fun. 75 and sunny. Yeah, it's a little chilly in Minnesota right now. I'm in South Minnesota, and it's been unseasonably cold these last few days, which is a nice break from the heat, but 75 and sun is about perfect. So we're right at 11. I think I'll go ahead and get started. So welcome, everybody. Thanks for hopping on today. As you might have seen from the description, I'm Sara Kelly. I'm the Facebook Live Build Up Dietitian speaker for this week. And I work as a wellness specialist, the wellness specialist for Olmsted County, Minnesota, which is in southeast Minnesota. I'm located in Rochester specifically, which is home of the Mayo Clinic. So we are the largest city outside of the Twin Cities metro. And I'm going to talk a little bit about kind of what I do and my experiences as a dietitian. And I would love for you guys to ask any questions, tell me about your experiences as well, and have a good conversation. So I have been a dietitian for about 10 years. I went to Minnesota State Mankato for my undergrad. I actually didn't plan on becoming a dietitian. I wasn't even sure what a dietitian was before I started school. I went just kind of in my early 20s just to see what was out there and what I was interested in. And I took a intro to nutrition class actually at Normandale Community College is where I started. And it was taught by a dietitian, and she was just wonderful. And I felt really interested in the material, and I found myself reading the book, and just because I was interested and not just to pass the test, like my other classes. And so from there, I just decided, this sounds good. I think this is what I'll do. And Yeah, it all kind of went from there. And, in college, I was very, very involved. I heard about the internship requirement early on and decided I was going to get a VA internship. And that was going to be very difficult. So I worked very hard, worked all through college and was involved in everything that I could. And miraculously, I got into the Bay Pines VA in sunny Florida, which I saw some of you are from Florida. I love Florida. And that's a clinical emphasis internship. I'm curious to see if any of you also were VA interns. One of the best days of my life because it's match day of 2010, getting that VA internship. And so that was in Florida, and I decided to stay down south. So I started my career in South Georgia, working for a hospital called Phoebe Putney as a clinical dietitian about 10 years ago. And so I've kind of worked in a lot of different areas of nutrition in these past 10 years. I was clinical and then moved to dialysis down in Florida, and then came back to Minnesota after I had my son to work for a large supermarket chain up here. So was a retail dietitian for about 4.5 years. And then about a year and a half ago, I saw the opening working for my local government, and I decided to jump on that for some more stable hours. So working in retail is obviously a lot of nights and weekends and even holidays, and having kids at home, that wasn't ideal for me, even though I did love my job there. So I've been with Olmsted County for about a year and a half. And historically, the position that I'm in has always been a nurse. So I'm the first dietitian in this role, which I think is exciting, and I can bring some new things to this as a dietitian. But right when I started was when they sent everybody home due to COVID. So it's been an interesting transition. I'm curious what you all do, and if anybody else works in the government, for the government sector, and what you all do there, because I've found there are a lot of different positions for dietitians within the government that I didn't know about previously. So a typical day for me, it really kind of varies. As you can see, I'm at home. I've been working mostly from home since I started, but it's been kind of a mixed bag, and we're kind of in the hybrid period now. Working from home is interesting. As a dietitian, I've never been able to do that before. Anybody else remote working, it's wonderful. Yeah, supermarket dietitian, yes. Yep, I did that for 4.5 years for Hy-Vee. It's a great job, lots of fun. So as a wellness specialist, my job has really transitioned into a lot of project management. So historically, it's been a lot of meeting people face to face and seeing how are they doing and helping them with whatever they need. But obviously that wasn't possible with the pandemic. So the job has really changed in the last year and a half. And I've been able to kind of put my own spin on it as a dietitian. So some of the things that I've started is obviously I offer nutrition counseling. And in my job as a wellness specialist, I focus primarily on employee wellness. So within the county, we have a lot of different departments, like the sheriff's department. We have about 1,200 employees, and it includes everything from public health to parks to trash and recycling to sheriff's department, child protection, a lot more than that. So it's a huge diverse employee base, and my primary responsibility is helping them out with wellness. So we have just 2 of us full-time on the wellness team for Olmsted County and 1,200 employees. So pretty busy, and a lot of what I do is project management. So searching for things that can help our employees with their wellness, coordinating with their health plan. Oh, hi, Frank. Nice to see you. Yeah, one of my fellow coworkers from Phoebe many years ago on the call. Are there things that RN who was doing the position previously was doing that you can't do? Yeah, actually, funnily enough, I had to really kind of learn how to take a blood pressure manually. It was one thing I had never done before. So my boss had handed me the stethoscope and what is it called? Blanking on what it's called right now. And I said, oh my gosh, I haven't done this since college. And so spent a couple hours watching YouTube videos about how to take a blood pressure manually. And I'm still not real confident in my abilities, to be honest. I convinced her to buy a digital one, which has been awesome. But some of the things that the nurses do, I can do as well, like blood work. So a lot of my face-to-face interaction with employees involves checking cholesterol, checking A1C, which is awesome that we can offer that for our employees at no cost, not through the health plan. I'm the one that they can go to do those things, and I have an A1C machine and a cholesterol machine in my office to check those at any time. So it really allows our employees to be proactive about their health, and then I can offer them nutrition information based on their results, which is awesome. And it's a unique thing that I'm able to offer. As a nurse, of course, you don't quite have that nutrition background to offer that advice in the same way that we do as dietitians. Another thing that I have been able to bring is I'm very passionate about intuitive eating and body positivity, and I'm trying to steer away that focus on weight within my place of work. So historically, people have had to, step on a scale during our annual biometric appointments, and we've moved away from that, and I've encouraged them to continue that practice, and let's move away from rewarding people based on their BMI, and let's focus more on mental health, positive habits. And one of the things I've done is bring in a speaker on body image and body positivity by the name of, her name is Reagan Chastain, and she's done a couple of presentations that have gone over really well. So that was one thing I was excited to bring a new aspect and awareness to body size diversity, and it's such an important thing. One of the things I've noticed since I started within the county is just all of the different positions that dietitians can do. So I think we focus a lot on that, the clinical aspect. Obviously, so many of us are employed in the clinical realm, but within the county, I have a friend who works, the official title is sanitarian, but it's basically health inspection, and that's a different area I had never considered. As well as there's a dietitian that works in communications as well, so health communications, and was largely responsible for a lot of our COVID communication, as that was a big project. So as I mentioned, a lot of what I do is the project management. So and obviously this job has changed a lot because of COVID. So it's been a lot of learning, and I still feel like I'm learning. But one of the projects I was working on was testing all of our employees for COVID antibodies through the Mayo Clinic, through a study. So I was doing a lot of sort of the admin work rather than the actual pricking of fingers. But it's been a different thing for a dietitian to do, for sure. How did you convince them to hire an RD instead? The position when I started was open to nurses or dietitians. And so I'm not sure what really had planted that seed, but I'm thankful that they went with a dietitian. And I went from the private sector to the public sector now, and I've definitely noticed some changes. So the retail realm was very fast paced, and the government work is not very fast paced typically. And it's been kind of a little bit of a breath of fresh air to take some time to breathe and to not be quite so busy and focused on sales and things like that. Do you also have a budget available to you? Yes, we within the county have a large wellness budget, and I'm not alone, of course, on that team, but it's myself and my boss that manage that budget and allocating that. Let's see, let me go over these questions here. So as I mentioned, the difference between private and public sector. One of the other benefits of public sector work that I've noticed is I have a pension, which I've never had before. That's definitely a benefit, and moving away from 401k. And we talk a lot about, in the dietetics realm, about our pay. That's a very controversial issue. And one of the nice things about government work is that it's very transparent. So I know previous jobs I've had, don't talk about pay, hush, hush. So, there's policies against talking about how much you make, and can lead to a lot of animosity amongst coworkers. And within the government realm, anybody can Google how much everybody makes. It's very transparent. And I think that's a positive thing for our industry as well, that there's no secrecy over pay when you work for the government. It's very cut and dry. So there's a lot of people hopping on. Where are you all from? I'd be curious to know what you all from and where what you guys do. So I'm currently not really involved with any DPGs, but I was a geriatric nutrition specialist for 5 years. When I was working down south in Georgia, I would contract with a nursing home on the weekends. And so through that, I was able to earn my hours to take the geriatric nutrition specialty exam. And I held that for 5 years. I also did some home health work on the side, and didn't decide to renew that because I was working for Hy-Vee. It didn't make much sense. I didn't have the hours, but so I do have that background in geriatric nutrition, especially. I'm passionate about helping healthy aging, and that's kind of been one of my interest areas and focus areas throughout my career. Is there any type of association of state government wellness coordinators you belong to? Yes, actually, there's one that's just based in Minnesota that we attend. Of course, it's all virtual now. I personally would like to go back and get my master's degree and learn more about marketing, communication, going into that sort of realm. I've kind of found myself not being quite clinical focused as I've kind of grown in my career. So I think I started out really being passionate about helping and focusing on that one-to-one communication with patients. But I think now I've kind of figured out I feel more comfortable behind the scenes, which is one reason why this job is a good fit for me, because it's a lot of project management. And but I would like to go back to and get my master's in business administration. But I just paid off my undergraduate student loans this week. So that's kind of been the barrier there. Been 11 years, and it's a good weight off my shoulders. So regional registered dietitian for long-term care. Awesome. Yeah. So that's kind of my long-term plan, is the master's degree. And I was actually just kind of trying to catch up yesterday on the changes that the Academy has made to that, because I thought it was this year that dietitians had to have their master's degree, but I guess it's been bumped to 2024. I feel way behind. Obviously I'm the only dietitian on my team now, and so don't really feel necessarily always up to date on what's going on. Have to kind of scope out those opportunities. Previous jobs, I've always had a large dietitian team to kind of focus on and bounce ideas off of, and I don't quite have that anymore. Private practice, awesome. Would your job pay for some of your tuition for you to get your master's? They do have a tuition reimbursement policy, which seems pretty similar to other places I've worked, where they'll pay for astronomical. And yeah, there's a VA. Okay, or maybe you mean Virginia, not Veterans Association. So one of the questions on here: what advice would you give nutrition students, RDs to be, new career RDs? I think I found that having that clinical dietitian background, that foundation, is very important. I think I learned a lot in my first 2 to 3 years working in a large hospital and learning about all the different conditions and things. So I think, my advice would be, if you're searching for an internship, be involved as much as you can. Like I mentioned, I was very intent on getting a VA internship from the beginning, because I knew that was going to be the only route for me. And I can pretty positively say that if I hadn't got a VA internship, I wouldn't be a dietitian because of that, the cost barrier of all the other internships. So I really tried to set myself apart. And I remember I actually went and made business cards. I guess I was inspired by Legally Blonde. I went and got these sparkly business cards and included them with all of my packets that said, future dietetic intern. And I tried to do things to set myself apart from other candidates. And thankfully it ended up working out for me. But so really trying to find unique opportunities. And I worked also at a nursing home as a diet tech in the evenings, and was on all the committees I could in college. And that's really my advice, is work hard. And that's the best thing to do. I really hope that the match rate has gone up a little bit since I was in school, because back in 2010 when I graduated, it was about 40%. So hopefully it's improved in the last 11 years. Do you see yourself offering in-person classes for employees in the future? Yes. So one of the things that I started trying to kind of transition this position to something that you could do remote was I started every other week. I do a live wellness session for employees, and that's really been amazing. It's grown a lot since I started, And I present sometimes, and then sometimes I go out in the community and I get other presenters. But so like a few weeks ago, I talked about the updates to the nutrition label, and I did a couple of presentations on those changes. And I do those virtually. It's much easier because we have employees all throughout the county. Much easier to do things virtually than in person. You'll get a lot greater participation virtually. And so it's great that we've been able to transition to that. But yeah, I see myself probably doing presentations in person as well as time goes on. And we oftentimes have to present to like board members and administrators as well. And those are typically in person. But the virtual has been kind of a opening the door to do greater things. So like I even get to do some fun stuff. Like, for example, the county owns a zoo. So I was able to go out to a zoo and do a couple sessions on that, because wellness, obviously, as we know, wellness is more than just healthy eating and nutrition. So that's kind of been a learning curve for me, is learning more about mental health and financial health. There's so much more to well-being than eating healthy and exercise. And so bringing awareness to those other areas of wellness as well. So what made me want to become a dietitian? I don't know if there was anything specifically, as I mentioned, but I think the interest grew as I started studying nutrition and learning more about it. And I think for me personally, I changed my eating habits as soon as I started learning about nutrition, and that's why education is so important. And studying health coaching. So that's interesting that we have dietitians that are studying health coaching. I've seen that as a secondary certification, and throughout the county, we actually partner with several local health coaches to provide reduced cost health coaching for different things that I can't necessarily focus on, like smoking cessation and grief. And so typically those are nurses. So it's interesting that there's also dietitians going into that realm. Have you found that your retail experience has helped you? And if so, how? Yes. So I feel like the retail environment really requires you to be self-motivated and self-driven. When I started at the supermarket, it was basically, all right, go be a dietitian. There wasn't a lot of training, and everything that I did was largely developed myself. And you really have to be a self-starter to be successful in that realm. And I think this position is similar to that. So most of the things that I work on are things that I've created on my own without a whole lot of support or I guess training. So it requires you to kind of figure it out yourself. And I think that's similar with the retail aspect. The retail position also, you get comfortable with public speaking. And so my position now is also a lot of public speaking, a lot of presentations. So that retail dietetics is excellent for that, since my job at the supermarket was largely managing classes, teaching kids classes, which I don't get to do anymore, and I kind of miss those, but those were always fun. One of the things I was also able to do as a retail dietitian was I was able to partner with the Mayo Clinic dietetics internship program, and every year I'd reach out to them to hire one of their interns to help me with nights and weekends, and that was a wonderful thing. And I met so many great interns through the years through that, and they helped keep me on top of the nutrition world as well. I haven't taken any interns since I started with the county, but because I'm virtual, right, that would be weird. I can't bring somebody into my house, but hopefully as we start more in-person stuff, I would love to take on an intern again and see what the changes have been with that. Yeah, so the lifestyle coach, that's awesome. So that's another thing I work closely with our health plan as well. So obviously having a wellness team for most organizations amounts to trying to increase health insurance costs, right? So that's something that we look at as well. And having a dietitian on staff, obviously, heart disease is one of the biggest drivers of our healthcare costs. So how can we develop programs and help our employees to ensure that our costs don't keep going up? And yes, I discovered Build Up Dietitians through Andrew. So Andrew, who's on the team for Build Up Dietitians, I worked with him through Hy-Vee. So I met him a few years ago at a class. Yeah, Andrew's awesome. Yeah, definitely recommend going back and watching his Facebook Live. I went back and watched that. He's a very well-rounded dietitian. Any questions? Anybody have any questions? Yeah, we love Andrew. I love Andrew too. He's awesome. Yeah, I met a lot of great dietitians through Hy-Vee, and I actually, the time that I transitioned into this position was right when they unfortunately laid off about 200 dietitians. So that was last February, right before the pandemic. Hy-Vee went through some major changes, and I was offered the corporate position, but decided that wasn't for me. And this had came up, so it just worked out very well. But yeah, miss all my Hy-Vee dietitian friends. Yeah, so I definitely, if you're interested in working in the public sector, I feel like the position that I interviewed for, they specifically were looking for those kind of well-rounded dietitians. So having that clinical foundation helped, and having the public speaking helped. Currently not any DPGs. I actually, in my last job, I had to decide if I wanted to stay a member of the academy or get my CPR certification, and I decided to get my CPR certification. So I hope to be a member again, but currently not. I have been off and on throughout the years, and business communications, that would be an awesome DPG. There's a lot of wellness associated groups out there, like WellCoa, that we work with through the government. It's like mostly HR wellness professionals. So kind of trying to be well-rounded, move not just dietitian related, but focus on all those areas of wellness. So I forgot to mention at the beginning, I don't really necessarily have a public nutrition social media account, but I am on LinkedIn, and so that's the best way to connect to me is search Sara Kelly on LinkedIn. The hardest part of your job. So I would say the transition from retail to government, the hardest part for me so far has been the sitting. I know that might sound ridiculous, but I feel like in the retail setting, you're up, you're walking around, you're moving, you're talking. I would leave with 20,000 steps in a day, and transitioning to a more computer-based job has been a struggle for me. So I would love to hear any tips you guys have as far as staying active with a computer job, because that's definitely been a struggle for me, is staying active when most of my job involves sitting and attending meetings and not necessarily moving around. So we as dietitians know how important it is to move around, and I feel like it's need a little bit of work with that. But the working from home has been wonderful, and definitely interested if any of you are able to telecommute. It's not a typical way that a dietitian can work, right? Usually we have to meet with folks face to face, and I do a little bit of both. So I go in 2 to 3 days a week, but it's nice. I have a flexible schedule. I get to kind of decide when I want to go in, and working from home has been awesome for work-life balance. And it's definitely been a blessing that I'm grateful for due to the pandemic. So it's one of the positive things that has come out, right? And I know a lot of, they're really looking at ways to keep telecommuting a permanent thing. So I don't imagine I'll ever have to go back in the office full time, which is really cool to be more of a hybrid option. So that's definitely been one of the hardest part of my job, though, is transitioning to a more sit down, not so active role. And there's obviously in the government, things work a little slower, right? So it takes a little bit longer to have decisions made, and I'm used to more of the go aspect, which is the retail setting. So retail setting, it's like, oh, you want to do that? All right, go ahead. Government, involves a little bit more work than that, and takes a little bit of time to get things accomplished, and getting used to that. It's definitely a slower pace. But, I think the benefits outweigh the negatives overall. So my typical day, for example, today, Fridays are usually pretty slow, but had a meeting with our public health department to talk about their wellness goals for the year. So that's one of the things that we do, is meet with all the different departments individually, annually, and we talk about what are they working on within their department for wellness initiatives, wellness goals, and what can we help them with. So I meet with employees one-on-one, but then I also focused on big picture things like partnering with one of our local fitness centers to provide a 12-week personal training and nutrition program offered by dietitians, because I can't do that, obviously, all by myself with our 1,200 employees. So looking for resources within the community, also working with, we have a diabetes prevention program that we just launched, and so working on promoting that and making our employees aware that that's now available. I also work with all of the paperwork for those things. So some of those things have a cost associated, although the wellness budget pays for a good bit. But health coaching, as I mentioned, we have a lot of those different homegrown wellness programs that employees can take advantage of at a significantly reduced price. And then I manage all of that. We do have to show outcomes of our programs. One of the things I'm still kind of learning, because in the retail setting, it's all about how much money, right? That's the only thing that matters. But within the government setting, that's not the same thing. So it's more focusing on those health outcomes. So I work on creating surveys, creating communication, and managing all of those lists of employees that are participating in these programs, and then communicating with them regularly to see their outcomes. Is COVID prevention part of the wellness program? It is actually. That's been a large part of my job in the last year, is things related to COVID. So I mentioned working with all of our employees on a COVID antibody study. And then also we have an incentive program that our employees can participate in each year to get a discount on their health insurance deductible. And one of the things we added this year was COVID vaccination. So they basically get points towards a deductible discount if they get their COVID vaccine. And so within their county, public health is one of our departments. So I know that one of the dietitians was activated to work on some things over there, work on communications and resiliency and different ways dietitians can contribute to the pandemic response, other than just in that clinical realm. I think we're almost at our time here. This was fun. A little bit scary, but I like to do things out of my comfort zone. And yeah, you can reach me on LinkedIn. That's the best way to reach me. I check that every so often. And thank you for this opportunity. This was very cool, very fun. Nice to see you all. I hope you all have a good rest of your day and a nice weekend. Bye.